te atuai au uli manuia. Fio le fio ngā ko vansili a meri Samoa ta maale tunu. Fio koi la fio ngā ko vana lutena. Ai tainani le pa ia o tuku mai e ta maali ina whai la uma. Papea foi le mamalu man pa ia o pa atonu sili, pa atonu langolango. Manisio o kisa sa itasi ua paian pa atasi mai. Mai tau atu foi o loo awai mai foi le sunga te au ia mangeo. Tato pa atasi na nea o uli. E pa talo pa atu ma pa keo a iatu. Pa teitele mo le pa amanua ina o tau teini. So te awai mai ai le leipun sama. Ai meise o le sa pailo atu nei tai au. Ia e whakea lava tatou whai ngā mālo ai ei lava tūlanga ma ale ale whakea. Ia ai ei lava tatou whakisi nei e whakaweo na tuina atu. Ia ai manatu o le auma o auti o le nei ia o uli. O le wholasanga leo le apukeit o le tūlanga leo le misela. Ia o loo kolinga mai o loo mawai tatou whai ngā mālo. Ia, ai le i tuinatu la manoa le whātonu ia mutsa. Ia, o la mua tu atu la manoa le sunga le whātonu ia sa mana bea bea. Ia, musa manoa mo sana kuku. Ia, tuinatu lea o tatou o le manoa i le sunga le whātonu ia mutsa. Pero la tuyo lo itaitu manyaima tatu atachale sera tuko sana itu lama po ibu oi tatu pai ngamalo ya lo fio mai le patron sama
ai kongole man ko ka ko uli ye neo ya no soma ko la mo soma la sta ala ka ko 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 sumali Rausi, Francesca Occaro, Yei, Nea Uli, Poi.
Tanto, Pifo Mazzaro. Ua Mato Koto Mai Ventuna. Mato Te Natu Yoluma, Nene Famolo. O Senilo e la Sina Sina, lo Mato Tu. E Mato Te Ia, Famolo. Talo atu tata mai no o fanga me me uma matu te fanga mo ya o matu te la fo ya matu poto maro matu la matu ya ti lo si fanga talo lo fata si mai o sua fo de su ben
ya ka komo ale ni a kale puti male na na pa ti ya ko no e o fio mai ko ga mai sa ma ai ka pa ku ta
Akule si wato ko wana lutena e se foi le malole si unha fa fenai malu fo o kabineta ia ai mesele malu fo sunga i formal ia mai tato umo le nei tu la daso allora ave toi o ina pa io daso ia o se anga ia ma ua ia e se temi awa no fo i tato te o mai fatasi ai ia se i tato whalongongo ma fo i e tūlanga ro i e tātou whainga mālo ia o lea tunu. A lātu lea i le vāanga soi fua mālo roi. Ia e whapena fo i mauta ngasi. Nā uto lau silfia o tau fia o ngā whanau. Ia e misi fo i si fo i o take cares ma. Ia ma se tātou whalongongo fo i nei aso i fuafuanga. Ia a wāleanga i lumo ne. Puipuinga so i fua. Walo ma whanau le atumi. E le phone name ta upu i a tātou. o le kumon e le fou ia sa outou tūlanga fo'i o le COVID sa outou tūlai fo'i ma e puna wai ia ua fo'i le puipuinga o le lautele puipuinga o le malu le atanu le nei fo'i lao le a tātou toi fufua anga i lumi ia o puipuinga o alo ma whanau o si o tātou atanu le anganga whaftai mai ai maua i le fionga i whatonu ia mesi e sunga i fomai ma o tō uma o loo iei le tawhaioi o le soifua malolo ina ia o tō sile nisi tūlanga ia o whamomua le puipuinga o alo ma whanau le atunu ia fo e tātou wanga i luma le temi o tuanai a whaina soifua ia lea ngā uma tātou tau whainga ai whaftai le sila mamau whaftai le tūla i le alofa whaftai foi le waai ia oa le anga i luma si o tātou tenu man whainga malo ia o le mea sili whaftai le tua lele o a whaina tele ni ia se isi po ua tūla i meini whapewhea ia lele lava e tātou te ngai atu ia puipuia ia aua ni pisi pe e nisi matu e nisi whale tonu matu ia ona a whaina i fōlei o tātou tautua le atunu mo le atuai le nganga whaftai atu te uma ma le anga i luma o tātou whatonu ia whionga i whatonu ma matanga luenga ia o mai lea tātou o sapai al whamamoe sapai al fufuanga ia lea la a tātou anga i atu iai telefo i whale tonu o tau silfia na tātou na tupu ma le taimi o COVID ia me se leua whaalu i tua o ngā whanau sa tau pole lava ma whawhau ma nofnofo atu ma le kovana lutena ia leu tau silfia ua ngai o le a whaiwu i ua onga ia a leu tupu mai nei a whamai ia ai uma tūlanga ia na tātou tau whainga taimi tuana ia o ngā whanau lunga o le TV ia matulanga un whapena e le mawhai e lwaanga wa onga o na whaitotasi e le mawhai e lwaanga tio i o na whaitotasi e mana mia so soni mai mtanga luana uma ia lava tā pena whanau ia le lei o lato wa onga ma mautu le anga e whaisina umi o le teimi lela anu no foitua whapena fo isi mtanga luenga o lo lato fua me se fo mtanga luenga o soifua maloroinga ma le tanga luenga o mautanga sengasi ia li mta mai tai fo mai ma lau tau si mai ia so soani mo fo tātou e wha mautu, wha mausari ia tu langa o lo tā pena tu iei latou ai wha mua tātou i whai tātou ma wha o onga ia o latou tu langa umo o tau whainga ia lofa le atua le tātou whamoemoe, lofa le atua le anga i lumo o le tau whainga o tātou whainga malo, ia lofa mai fo i le atua i si o tātou e tenu. Ia e mese le nei tūlanga o iai, whaftai.
Rai.
Ni mo ta ta ro pa ta lo wa pu le ko ko le o ri de so wa le ta ko ko so ta ni pa ko le pa lo na pia da pu wa pu le presentation le snapshot of the Samoa situation report mo se pa para lo wa pu le va ta sa o le ku ta wa lo le ta ta lo va pule o komai ma pule o komai na panmai i kumaro. No ai kukam kawe sunga ya kapisai o le assistant medical director of Karamana o lo que contamos de suma ya scan anesi o yo territorial epidemiology ya uno no lo pude era ahí o está policía de por lo FDA como bueno a la macaron maco pasó el curso de pueblo taco situation la luego la pasada de la de buena prima yo como payaso de luz en el para que lo no es el malo que hay que payaso es que se entra verdad como oiga después con arroz ya lo subo ahí a eso ya todo lo nuevo para contar todo.
Thank you, Honorable Governor, Honorable Lieutenant Governor, and Cabinet. As of 1400 today, we are still reporting one laboratory confirmed case. We have increased our probable case numbers to 31 probable cases identified through symptomatic diagnosis and referred for evaluation and confirmation. The age range for these cases are from 2 months old to 13-year-old, and we have about an even distribution for sex. So it's affecting both males and females at the same time, and the age group range there is 2 months to 13 years old. As you can see our map here, there are two different types of cases here. You will see the index case here, which is case 1, as well as case 2 and 3. We are looking at the difference between inactive and active cases. Yellow shows the index cases as well as those that are inactive, but more concerning here is the active cases. On March 23rd, this is where the first case presented to the health center, which is index case 1, 8-year-old female from Kananafo School. The cases that are surrounding in this area, this is the Ili range, where the cases that were all reported back and had links to this initial case started. The outbreak then started to spread as we saw cases into Fanga'alu as well as Pango range that are all linked to this case. We were then able to activate our active surveillance and investigation teams and have been able to find spread cases from Fangali'i to Onenoa. And just of this afternoon, we're reporting case 31, which is the newest case, is linked to case 15 from Aunu'u. So this is a village breakdown, the count of all of those suspected cases. As you can see, where we are suspecting the outbreak started was in the Ili range. This is where the index case lives. Those that are involved or part of this count were directly linked to that case. We also have other links, but as you can see, Ili is predominantly high, as that's related to the index case. We also are seeing cases in Nu'uli, Whangatongo, Ta'awheta, Leone, Onenoa, Malaimi, Awa. All of these breakdowns will show that we have active community transmission in the territory, which is part of the advice that was given to the governor. Because we are showing that there is widespread community transmission in all the villages or all of the districts in Tutuila and as well as cases in Aunu'u, the advice was to stem community transmission through the closures of schools and the targeted population. Well, now, would you like to ask questions about that surveillance before I move on to vaccinations, Honorable Governor?
They came forward, or you guys went out and checked the cases? No, all 20, all 31.
Are they reporting in or?
Yes, Honorable Governor. So the recommendation from the medical team is that when we identify a case in the community, they are first assessed through the pediatric unit or the on-call attending physician. At such time that the physician deems that this case would warrant a investigation or be part of the probable case definition, the lab team is then dispatched to collect the sample, and the nursing team is then charged with follow-up for that individual case. Isolation of the case as well as recommendations for home treatment is then done by the nursing team with follow-ups and advice from the medical team. There's a roster, when Dr. Laval does her brief, there's rosters of physicians as well as nurses that are operating on a 24-hour basis through our hotline and through our field teams that go out and make sure that the care for that individual is done. At this time, there is no recommendation from the medical team for quarantine of the family that's associated with the case, but self-isolation of the case is warranted for home isolation. And Dr. Sai and Dr. Laval can elaborate more on that during their presentation.
Sir, have you done contact tracing for all those 31 cases?
Yes, sir.
Okay. And has any of that contact tracing showed that the infection was caused from the U.S., Hawaii, U.S. mainland, or Samoa?
At this point in the investigation, we've been able to backtrack it for 2 incubation periods. So we're looking at about a month before the presentation of symptoms. As such, we are not able to definitively say whether this is where the link is in terms of travel associations. The investigation is still ongoing. There is a team that's associated with that. But the primary concern here from the medical team is to go out and actively seek cases that are active and symptomatic. The difficulties in backtracking the investigations is now that the information is out there, it's a lot of recollection of information. So some would say, well, maybe they were sick, maybe they weren't. But there is a team that's continuing to do the investigation just to establish where the point of reference is for our initial index case.
Do you confirm there is no outbreak or confirmed measles cases in the U.S., Hawaii, or California, or Samoa?
Yes, sir. We were, as reported this morning, only the Western state epidemiologists were reporting to us. We did have our call with CDC this afternoon. No region in the United States is reporting cases. We also had WHO meeting, and no South Pacific countries in our immediate jurisdiction are reporting cases.
Okay.
However, they did mention that they are starting to ramp up testing in neighboring countries, and so we should know a lot more as their tests come back. So Samoa and Tonga, they're sending their specimens to New Zealand. They're using case profiles similar to ours, and we'll know a lot more as they ramp up their testing. Right now we're in active phase, so we're actively testing.
Okay.
Those countries are now actively testing, and we'll know more as we get the information.
All right, thank you.
So as of April 22nd, 2023, this is looking at our MMR coverage for all schools. So this includes ECEs, elementary and high schools. Right now, the coverage for these schools is at 89.4%. As many of you are aware, the requirement for education is 100% immunizations for those children that are in the education system. We have been evaluating this and establishing our target population. So of this population in all of these schools, the target population here is those with no MMR dose and those that with 1 dose. So that population, 2.9% of those that are in these schools have no MMR dose, meaning they are not covered by the MMR vaccination. We have this population here that is 1.8% that have had the first dose but now need the second dose. 4% of those that are currently have the first dose, this is broken down into those that are eligible for the second dose at 4 years of age. So this population, the reason it is in blue is because they're just awaiting their second shot, and they have already been seen. Those that are in green have also been seen and are due for second dose at the regular intervals. The concern that we have here is this population here, is that this population, they've received 1 dose, but they've missed the interval between their first and their second dose. The next one is that they haven't received any MMR dose at all. And so this is part of the targeted program that my colleagues will talk about in terms of our outreach and target vaccination. So this is a breakdown that's separated between public schools and private schools. As you can see on your right-hand side, the public school coverage is 98.0%. We do have a small portion of that population, 1.1% have received the first dose, but have missed their intervals for the second dose. 0.9% have received no MMR dose at all for these public schools, and this is for grades 1 to 12. I remind you, grades 1 to 12 starts at 5 or 6 years old, which means that those children should have all had both doses. So what we're finding now is there are pockets of our population that are unvaccinated for the MMR dose that are currently in these schools. In the private school sector, we have 93.7% coverage where the series is complete for all the MMR vaccines. 2.4% of those have missed their regular regimen for the second dose, and 4% of those that are attending grades 1 to 12 have no dose for immunization coverage at all. So these are the targeted populations as we evaluated, and we wanted to close the schools and go out and immunize. So as part of the immunization and vaccination program, this is the percentage, and these are the targets that we're out there to go and vaccinate. We have the list of their names. We have gone in with Samoan Affairs and have come up with a plan to go out there and start to start our immunization and mass vaccination campaign to make sure that we get this up. I know there's questions in the community, well, at what point are we going to be allowing them to go back to school or even opening schools? The fact that by law this should be 100% for both private and public schools, that is the goal for the Department of Health, is because they are required by law to be 100% vaccinated, we will make sure that they're 100% vaccinated before we can start to say that we can release the all clear. So this is our area of interest, the ones that we're most worried about in the territory, which is why the ECEs and the daycares were closed down first. As you can see for the daycare and the ECE, on your left, this is for all daycares in American Samoa. So 44% of all daycares have their series complete for those that are eligible to get the vaccine. 34.4% are on track, have already been seen through the health centers, and are awaiting their second dose. The big issue here is this 16% that have had no shot or have not come in through the health centers at all. So as you can see, this is a large portion of the daycare population. ECE, as they're a little bit older, is faring a bit better. So 73.8% of those that are in our ECEs have their series complete. And only 1% has no shot. 6% of those have one dose but are out of the range for the second dose now. Apologies, this is a typo. This is meant to be elementary school. So for the elementary coverage, 96.9%, with only 1.5% with no shot and 2% outside of the coverage for their second shot. High schools, 97.4%, with one dose here at 2%, and no dose at 1.2%. As you can imagine, now these students that are in elementary and high school have now had a longer period of time without their second dose, even though they need them. That's why part of the new regimen is to get them started back into the dosing regimen so we can completely immunize those children. So as the April 19th is when we ramped up our vaccination campaign, we've been able to identify a little under 800, so about 790, that's from those percentages that I just showed, 790 in the elementary and high school range, as well as 394 in the lower age ranges. Of that, that is our current denominator for full coverage. Of those from April 19th, till now, we've been able to vaccinate 159 of those children. And the graphic on the bottom is broken down into which of the health centers. All the kids are broken down into regions in the territory based by where the health center is that will cover that region. But the main take-home message here is that we want to make sure that we're vaccinating as many of that list that we have. So we've got about 790 in the elementary to high school and 395 in the lower age range. That's the denominator. Right now, of those, we've been able to vaccinate 159. And when Dr. Sai and Dr. Laubao mentioned the plan that we have to get the rest, you'll see how we're trying to lower that number. So these are the current vaccines on hand. We've administered these to each of the health centers as well as the storage depot. There are 633 vaccines that are currently on hand. An update is that we are going to get another 1,300 on tonight's flight. And we also, by the end of the week, we should have 3,300 pediatric vaccines and 3,000 adult vaccines. Any questions before I move over to clinical operations? Yes, sir.
The COVID vaccine was not as good as, once you take the COVID, there was still a chance that you can get COVID. What is the situation with the measles? Is it a complete immunization once you take it?
After the first dose of the measles shot, you would be 93% coverage, meaning that of all those that take the first dose, 7 out of 100 will still get the virus. If you get the second dose, you're up to 97% coverage, and so 3 out of 100 would be able to get it. The main issue that we wanted to stress in the public is that you can still get measles even though you are immunized. And one of the main points is that the severity of the disease, much like with COVID, although you could still get COVID, the main reason behind vaccinating from COVID-19 is that your symptoms will be mild because of the vaccine. And so for measles, this age group is susceptible, primarily those that are ineligible for. So those that are lower than 6 months. The main takeaway message here is that you still run the risk of contracting measles, but if you are immunized, the severity of those symptoms is mild compared to an unvaccinated case.
I'll be talking about what's going on with the community health centers, what are we doing over there, how do we protect the patients and the staff that are coming to the community health centers, and our clinical operations. Next slide. So as Scott was talking about the measles cases, we have to provide the case definitions of what we're using to diagnose these cases. So we divided up on there's three type of cases that we need to use for case classification for measles. So the first one is the suspected case. When we talk about suspected case, that means these are children that have symptoms of measles, which is a generalized maculopapular rash, lasts for more than 3 days, temperature of more than 101 degrees Fahrenheit, and a cough. Coryza means runny nose, and then conjunctivitis, which is redness of the eyes. So these, when a child have these symptoms, these are the suspected case that we also testing whether they have measles. The other type of case is probable case. These are the case that has the symptoms, but they're not linked to another, they're not linked or exposed to a positive case. So these are the probable case, not linked to or to a positive case. And then a confirmed case is the one that's confirmed by lab investigations. As Scott said, as of today, we have one confirmed case from that confirmed by the lab, and there's 31 probable case that we are following up based on these case definitions for the measles cases. Next slide. So the reason why we're asking for closure of public school and private schools so we can move this measles vaccination campaign is, as you all know, measles is highly infectious, and we all remember what happened in Samoa in 2019. So it's a highly infectious disease, and it is proven that one child with a single exposure to the virus can expose 18 unvaccinated children with one single dose, can affect about 18 unvaccinated or those with a single dose. That's how infectious this measles is. And also, as Scott explained, our coverage rate for our daycare and ECE centers are low, not even up to 90 or 95%. So the coverage rate for all the students in American Samoa is 89.4%. We want to move that coverage rate for all the students from 6 months up to the 17-year-old to up to 95 or more than 95%. In that way, that the children of American Samoa are protected. The other reason why we're asking for school to be closed is because elementary and high school students, if they're exposed to measles, the risk is low for them to get severity or get more sicker. But the problem is these high school and elementary students will go home, expose their younger siblings, which are the age group that can have the 6 months or below. So they can expose their younger siblings at home. But if we close school, they can stay at home, it's a smaller number of people at home. But if they compare to go to school, they'll become the super spreader of all the measles disease to other students and other community members. And these are the three reasons why we were asking the governor and ASG to close the school so we can push the vaccination for the children. The other population that we worry about is the below 6 months. Because below 6 months, they cannot be vaccinated for measles. And that's the population that can become more severity and more sick and be admitted at the hospital if they contracted measles. Just to update you on the 2 cases at the LBJ right now, there's 2 cases, you can correct me. There's a 5-month-old male who's over there at the ward, that measles ward, and also there's a 2-month-old male too over there. So these are the ones below 6 months that cannot be vaccinated for measles. And this is the population that vulnerable for measles that we need to protect this population of children. Next slide. And also we like to, going back to the cases, just to let Governor and Lieutenant Governor what's been happening. So in March, we were informed by Samoa Department of Health there's a suspected case of measles in Samoa. There were cases of children with rash, with 1 case that was suspected for measles, and they sent the lab investigation to New Zealand, but it was taking them for so long to get it. So we started, DOH started meeting and go through our MMR vaccination when we heard this case from Samoa. And when they returned the lab results, it was found negative. So this is one suspected case is negative. But then we know Samoa is pushing their MMR vaccination to push their coverage rate like around 90%, more than 90%, because they had this suspected case. Answering to AG Finally question whether if it's traveling at that time, we're still investigating. We don't know if there was traveling for this one particular case that was positive within the family or what, but we're still expanding our investigation on that. And then, so when we tested this case, this is the case that we tested because she came with a rash. That's the case that was tested positive, is that case. Why it took us for so long to get the result? There was, after handling the case, sent it off island, and it took 3 weeks to reach us to say that this is a positive case. So we're working on improving our lab sending off island. So we already collaborate with LBJ. Whatever labs they do for measles, DOH is responsible to pick up those labs and send it off island. So in that way, only 1 lab, we're gonna send all these swabs and all these tests to Hawaii State Lab. So they're gonna test our labs for our positive cases or suspected cases that we're sending probable cases that we're sending off island to Hawaii. One message we wanna let everybody know is we really need to push this vaccination drive to protect our vulnerable population. That's our children under 6 months. Those are pregnant women because they can't be vaccinated when they're pregnant with measles, and the older population that have comorbidities and chronic diseases that most of them or immune deficiency that cannot be vaccinated with measles. So these are populations that really want to protect it. That's why DOH is pushing for this MMR vaccination drive. Thank you. Any questions? Thank you.
Yeah, Talo Falava. So with the update on the Department of Health plan for the mass vaccination, so all the doctors and the nurses have met, and this morning I was fortunate to work with meet with the Samoan Affairs and the mayors. So the plan is that I think with what we experienced in the past, we have been notifying the public in regards to the vaccination. So the clinics were opened as well as on the weekend, but unfortunately, with the outcome that we see, there's still a lot that needs to be done. So starting tomorrow, we've been working with the mayors of all the village. We'll be starting from Ili'ili towards Nu'uli, and we have about 30 plus teams of nurses, and including doctors, who will be giving the vaccination to all the, those who need to be vaccinated and those who are incomplete. Again, the main thing that we really want to make sure is we are so worried about the ineligible population, and that's the 0 to 6 months. And that's exactly what, we had those 2 patients who have been admitted, and we pray that, nothing serious is going to be happening. We were told that we've been monitoring, and we'll updating on that later. But that's the schedule for tomorrow. We'll be having our team to mobilize to the village, and we'll be working together with the mayor as well as the Samoan Affairs.
Just to update, the 2 cases at LBJ are doing fine. They're stable. There are less problems that they presented. They're stable for now. And also to let you know that we're doing an outbreak. We vaccinate the 6 to 11 months. We give them 1 dose to protect them for measles. If the children are sick, they had the symptoms, they cannot be vaccinated for measles until they're well. Then we go back and vaccinate them for measles. Thank you. Yeah.
Dr. Ledoux, you have...
Yeah, I just want to add on to what has already been presented by our Department of Health colleagues. As Dr. Lovao stated, we had 2 admissions to the hospital, and they are admitted to the COVID ward that was specifically designed to admit our COVID patients. During the COVID, we are reserving that isolated ward for all measles admissions. So we have 2 admissions to babies that are admitted there right now. One is a 2-month-old and one is a 5-month-old baby. One of them presented with cough and stuffy nose and typical signs and symptoms of measles. And the other one had some cough and some signs, but was mainly because he was not tolerating any feeds. He was vomiting. And that is the reason why he was admitted, and both of them at this time they are doing very well. One of them was supposed to be discharged home today, but there was some low-grade fever. That is why we decided to keep the baby back at the hospital to be observed for the next 24 hours, and both of them are most likely going to be discharged home tomorrow. They're both doing very well. I personally saw them earlier this morning, and they are both doing very well. The parents are both looking forward to take them home. There were 26 suspected cases of measles that were seen up to 7 o'clock this morning, and out of those, 15 of them had blood tests done. 11 of them had both blood and swab tests being taken, and those that have been sent home, we have communicated with the Department of Health, relayed the message and the patients over to Department of Health for their home visit, and they're monitoring when these patients are seen and treated and sent home. And likewise, for those that are admitted, when they are discharged, we will be handing them over to the Department of Health for home visiting and follow-up when they are at home. Now the process that we are doing at LBJ for all babies and children that are coming with suspected measles symptoms and signs, they are seen not in the emergency room. They are seen in a tent that we have set up, and that was our setup during COVID, where they are identified right as they walk into the hospital. If they have signs and symptoms of measles, they are directed to the tent beside the emergency room, and that is where they are seen and treated. If they need admission, they are admitted from the tent to the COVID ward, and the tent is just beside the COVID ward. For those that are stable and they need outpatient treatment, they need to be sent home, they are sent home from there, and they the Department of Health is contacted, as I said, for further follow-up. Right now, we are setting up a bigger tent for retention tent, and that is where some of the babies that probably, like for one of those babies that were admitted, that was vomiting, instead of admitting them to the hospital, we're going to hold them up in the tent, provide supportive therapy, give them IV and medication until they are better, and then they can be sent home. We don't have to admit them. That is what we are setting up. We are setting up right now to help minimize the risk of exposing these children to those that are already admitted in the hospital. We have sent out our measles policy in the hospital, and this takes care of the patients right from the time they walk into the door of LBJ until the time they leave the hospital door, and we have shared this policy with the Department of Health so that we can have a consistent managing these patients, whether they are coming into the hospital or they are out going back to the community. As of today, we have mandated masking in the hospital for all patients and all visitors and everyone that comes into the hospital premises. Inside the hospital, everyone is required to wear a mask. We have not touched on any visitation as of now. Once we make any changes, as we monitor the situation from now, if we need to make some changes to our visitation policy to the hospital, we will do that, and we will update the task force based on those changes if it is done. That is very briefly to add on to what our colleagues from the Department of Health have said. I think one thing that probably in the next slide that I would like to bring up is that we had a request from the Department of Health for some of the medications that they needed. We don't have much of those medications right now because we did not have any cargo flight last time, and we are quite running low of that, and that is probably something that we need. We would request a support because we don't know how things are going to develop in the next few days up until Friday, and also found out that some of our dialysis medications are also low because of the cargo flight. To support that, I would say, if there is some way we can probably expedite these resources to be made available. If we need assistance and we need help from DOH and also from our hospital, we will probably need to have those supplies and those medications especially on hand and be ready to support the services that are provided. That is all from LBJ, and if there is any questions, I would be happy to answer those questions.
Okay, thank you, Dr. Ado. Any other comment on the slide? Okay, we have a lot of ice going to emergency Samoa. This afternoon at 12 o'clock, we had an epidemiological meeting with off-island CDC, SPC, WHO, NOAA, and every other organization that have that collect data, and also Honolulu. That is where that meeting we were told that they will try to expedite our results. Around 48 hours, 24 hours, 48 hours. They also know that our specimen will arrive tomorrow morning at 5 o'clock. So they will be preparing for that and try to push those results to American Samoa. They're also keeping an eye on Samoa and also Tonga. There's some kind of different stuff going on in those islands. They're trying to keep an eye on that. Our next update with those folks outside the world will be Thursday at 12 o'clock. If anybody want to zoom in, we will be prepared to open all that up. So the more people that know what's going on, the better off we're going to be. So we're asking also our directors to please help our employees. I'm having problems with some of my employees not able to come in because of there's a lack of babysitting, daycare. So we're hoping to work with those folks. There is still report coming from the community about school still open. So I'm asking TCO and U.S. American Samoa National Guard to deploy to those areas and figure out what's going on and let us know, see what we can do to help. And I think that's it from Public Health. Honorable, thank you so much for our time.
Ja, a ICCC la a firma el gobernador last March.
Taru whaftai atu ngaua. Tau mau mai le. Nana tanga o tātou whamoi. Ia ai o te loe tere nei mta upoe I mana mio na ngā lulu whatas. Ere maru fo kapineta male tātou komiti whawhoi. Ia me masania le ua o activate kako IOC. Ia tūlanga masania fo o tātou whainga malo. Ia o tā pena foi le whionga ko wana rutena. Ia ma tā pena ina whamoe tātou whainga malo. Ia e wha uruwe tūlanga o tātou Michela. Ia ai fufua le tātou tāpenanga ia maua se tātou tali atu le atanu o telefisi, efsinia le atanu o tele o tātou leo le awhai. Ia ai fufua le lei, ia te lofo. Ia e whai fōi o le o le Michela. Ia e whai fōi o le atanu o whātua mai whawhō ma le COVID. Ia ua tau whewhe fōi leo. Ia le te ua fōi o tue tāpunia le lalolangi atoa. Ia ai a lean tātou tāpena ma whātala noa atu fōi lunga o le TV ma le ala māla leo. Whamalamalama le lei, ia tātou fōfua. Whamalamalama le lei, pei fōi na whasimingia e le nei aso. Nia ua le siana mea tātou a whaina mai COVID. Kolan me tui so o ai, ato e maua lawa COVID. Ia e whiua tātou e whamalamalama. Ia na whaiwhai ia e iwana. Ia and we ought to be patient as we go through with this process. For all of us need to work together to make sure that our public awareness is well established so the public can be comfortable and understand what are we trying to do. But mana bia fo iona vavia tātou ngā duana. Leanga te ua misi te mio a o ngā whanau. Mantua lena fufu lea te mio a o ngā whanau. I le samu. Ia wape I e o tāpenanga nai isi a o ngai tu atu. I leanga I luma. Isi a o ngā mau luma. Ona mio fo I tātou Samoan Affairs. O I le vanga Samoan Affairs. Ia tu le mai tu langa o tātou whamoe tu anu mawhioanga. Ia pena fōi le tātou vāanga o le public safety. Ia mai tātou umalawa whātonu ma tai fōi o whainga malo. Ia whamalama le tātou fōwhanga leanga I luma. Ai mule atu leanga whaftai I le tātou kāpineta. E le fioto ko wana lutena. Ia ma le malu tātou kāpineta.
Ya ele mga o, yang po ay lo kaya po.
Le ai, le ia whamau na mo, le.
Ya po po ay.
Pawhio tu le whio mai
Ito nga ya,
tēnā ngā.
Di pa mamra mai de.
Ia mato whato to, o le lang whai. O le tatu me arofa le na mo mai e a kosama. Nena na wole tu wha. Tūlanga o ngā me ka pena. Nena ave tatu wha moi mora so soan i le wha moi mora le whionga i a whama. Nāna na mato o ai nei. Ia na le warau mai le malo kapina. Ia i ngā inga po nei ainga. Ia nā mātou wā, to'o, ia malmaenga Samoan Affairs. Ia le nāna au mai le kufuanga to e aina i e kapina. Ia msara o lai lo i le tāwani. Ia miona le ala mai e li sa mga patolo. Ia sama. Ia tula o i Samoa. Ia tātou pasio. Ia tātou mas. Ia tua tu vaenga le tu whai. Ia paralo po i mai le ainga o Kuamatu. Ia wapo i tātou isi atu. Tātou na whapiri vana Samoan Affairs. Ia tātou o to i asina tātou o malo. O le asa topi le skutasi. Ia vesei le tino mariu. Mai kama. Ia o la mpore atu le o uno le atuana. Ia o la whaela na sami na amatu. Ia amore a vanoa. Ia manei fui sa me wali iai. Ia wale a whionga po vana o whalima. Ese smerito. Ia, whawhpeilo. Nanga laka o kope me sa manga ka kou e. Kere me le rakulaku i kumara. Ia, liria, ia ole. O watu whamtalana.
Pea mana so si uina tato konsana leia uli. Te whaktai atu mo le alai mai. Ia manu te reina to e nor neia so ia lema. Ia mai mai, ia. Whaktai tere.
I finalized my Christie. Finalized my Christie.